Hi guys, just this very short clip before we get into the main video. This is a comparison of two different visualization methods. So on the right is the new Waxscope, and on the left is the view you would expect with some head loops, the very popular head loops that most people use in the UK and also in other parts of the world. So that's the difference. A or B, which method would you prefer? Leave a comment in the comment section with your choice, and I will review later. I'll be very much appreciated, and hopefully that little clip can really hammer home the message as to why I've developed the Waxscope. Over the last year, as I've been presenting the Waxscope, I have had some kind of nasty comments about the Waxscope in terms about the optics and how much more that people prefer it over the endoscope. Well, I kind of do know the difference between the view because I also developed the iClearScope endoscope, so it's not that I'm not aware of the difference in view, and I keep stressing that I'm fully aware of the difference in view. You can't compete with an endoscope in terms of optics because the lens goes inside the ear. The problem with the endoscope, however, is it doesn't matter how good the view is if people can't use it, and unfortunately most people who attempt to use an endoscope really struggle. So that view is redundant. And when people can't use an endoscope, what's happening at the moment is that they're reverting to loops like I've just demonstrated. And the problem with loops is not only the body posture, because your head is kind of leaning forward so close to the patient's ear to be able to see anything, it's the poor magnification. So I hope that little clip kind of really hammers home the message and the rationale behind the development of the Waxscope, because if people can't use the endoscope, we don't want them resorting to suboptimal magnification like you just saw. We want them to have a very good alternative. Now, the Waxscope is an alternative to the endoscope, the iClearScope. It's not a substitute per se. So I'm not I'm not going to outphase the endoscope. I still use the endoscope most procedures. Although I've been using the Waxscope a lot more obviously in preparation for its launch, etc. However, there are some cases where I use the Waxscope in preference over the endoscope, particularly children who are not able to stay very still. It really helps you to stabilize the patient, because that's where with an endoscope you don't have a speculum. So just visualizing the patient's umbo, this is the center of the eardrums. You just got it in focus. You can see all the blood capillaries. You can even see all the fibrous connective tissue and the fibrous stratum layer, which is the middle layer of the eardrum. The eardrum's 3-ply thick. So yeah, I hope that little intro was very useful, and it kind of now hammers home, as I said, why I've developed it. So guys, if you don't like watching the Waxscope videos, that's totally fine with me. It's not a problem, but I'm not making this for your viewing pleasure. I'm making it to help improve ear care. So if someone is having the earwax removed and they're not using an endoscope, the most likely method is loupes. So if you're one of those people, you are aware of the difference now. And I would like to think, after seeing the comparison, the Waxscope is far superior. But yeah, that's up to you guys to decide. And if you're having your ears cleaned, that's obviously your decision, what type of view that you would prefer your specialist to have when doing the procedure. So to clear the right side, just concentrate on the left. I'm using the medium size speculi. This is a 4.25 millimeter. We've got a smaller one, a 3.5 millimeter, and two larger ones. If you are a suitably qualified medical or healthcare professional, so an audiologist, GP, physician's associate, a nurse or paramedic, but with 12 months minimum experience with performing otoscopy. And also we do train hearing care assistants, but they must have at least post 2 years qualifications and experience, and be in employment. They can't be employed by themselves doing earwax removal. They have to have a supervisor there. It may not be a direct supervisor, but someone that they can turn to, but it must be under employment, because a HCA really shouldn't be practicing otherwise. They are assistant to an audiologist. So just mopping up, and you can just see the magnification. It really does zoom in. You can see all the fine detail. And yeah, if you are interested in the Waxscope, please email info@clearwax.co.uk, and I look forward to seeing some of the comments in the comment section about whether you voted for A or B. Take care, guys. Bye.